Hello, hello, hello. Good evening. Okay, let me just tell you, friends, that I have been trying to make this video for like the past 3 days. My computer crashed on like 3 days ago. My computer crashed. And then I decided to erase everything to see if I could salvage the computer. And then my camera wasn't, my external camera wouldn't connect. So it's been insane. So if you're catching this, maybe everything conspired so that you would be here at this moment right now. Maybe you need to hear this. So today, what I'm going to be talking about, let me see here, let me make it bigger. How a wrong diagnosis masked a young woman's cancer. So, 2 years ago, she was only 28 years old. Ashley began losing weight. At the time, the Indianapolis native and mother of two was 6'1" and weighed about 270 pounds. She chalked it up. Let me switch here. She chalked it up to her busy schedule. She had started a photography business and she was traveling all the time. However, the key word here is she didn't know why, but she began losing weight without exercising and without changing her diet, she says. So that's key, right? There's a lot of conditions that can cause weight loss, weight gain, um, that are not necessarily cancer, but especially when someone starts to lose weight rapidly, if you're a nurse, if you want to, if you're looking to become a nurse practitioner, or even for yourself, like if there's a tremendous amount of weight loss in a short amount of time with no changes in what you've been doing with your daily schedule, or you've been eating more and you're still losing weight, that is concerning and you should definitely get that checked out. But a few months later, she began having intermittent pain on her left side. She went to see she went to see the doctor, who said she needed blood work. After everything came back normal, she was told to change her diet and avoid spicy food, which she says she did. And I think that that's something that as healthcare providers, we need to learn from this and learn that we can't always just rely on my hubby is watching. Thanks for watching. So, we can't just rely on labs and just dismiss what a patient says, right? We have to listen to our patients. It's so important to listen to our patients, to listen to their story. I'm a nurse practitioner, but I've been a patient and I've been dismissed so many times with my issues. And then it turns out I was right all along. So it's very frustrating and I feel your pain. So, drop a comment if you've ever felt like you've been dismissed when you've been to go see a healthcare provider. So a few weeks later, she began having black tar like stools and then diarrhea. So, again, even more concerning. So, black tar stools indicates an upper GI bleed. So, if you have bright red blood in your stool, it means that it's happening in your lower GI because it's closer to where it comes out. So it hasn't been like festering up in your colon, drying and getting that. So think about like when you bleed, right? When you first start bleeding, it's bright red, but as it starts to dry, it gets that like rust color. So an upper GI bleed indicates will show like black tar like stools, whereas lower GI. And if it's like super bright red blood, it could be hemorrhoids, but it's always important to go get checked out. So it's concerning that it's black tar-like stools because again, it's indicates that the bleeding is happening higher up. It's not like if it was bright red, it could be hemorrhoids. It could be like an anal fissure. I know this is like if you have a queasy stomach, an anal fissure is like sometimes if let's say you're having a larger than you're constipated or you're having very large bowel movement and you kind of tear down there, you feel it expand. That's an anal fissure, and then you're bleeding. She says that whatever she ate went right through her within 10 to 15 minutes of eating. So she went back to the doctor. Worried, she questioned if she should get a colonoscopy. And, good for her for advocating for herself. But, you know, again, being on the patient side, it's like, why am I the one having to tell the doctor what to do? Like, you should know, right? Um, so she said she was turned down she was told she was too young to need the procedure. Desperate for answers, Teague asked for additional tests. So I'll play devil's advocate. Maybe the healthcare provider considered doing the colonoscopy, maybe insurance rejected it. But if at first you don't succeed, try again, right? If you truly are concerned, or maybe like you're like, you know what, she's being very persistent. Let's see if maybe there's something there. The way that you chart, the way that you add your evidence, right? Based on your symptoms, your presentation, and your ICD-10 codes, you could push for this colonoscopy, right? And so we'll never know for sure if it's the doctor that didn't want to do it, or if maybe like the insurance wouldn't cover it. So she said, okay, can I at least get a CT scan? Can we just run some tests? Because I know my blood work came back fine, but I'm literally telling you something's not right. I'm not feeling right. That's literally, again, what I told my provider when I went to see him, when I was like, I don't know, something's wrong with my body. I literally don't feel right. That was when I was in the middle of like my breast implant illness. And I was like, I don't know if I have lupus. I don't know what's going on, but I'm not right. Just dismissed. She said she's not sleeping through the night. I'm being woke up to my stomach, sounding like somebody's fighting in there. It's just a constant rumble. And she's like, okay, it sounds like IBS. So we're going to treat you for IBS. So irritable bowel syndrome. Actually, my husband has IBS. IBS can happen. It can occur like in adulthood, but normally it doesn't happen like boom out of the blue. Now I have IBS, right? So not the best differential. Like for example, people that have IBS, they probably struggled with it as children, right? Or they had it in early adolescence. It doesn't really show up later on in life. And then IBS doesn't have the bleeding, the black tarry stools, right? Something is going on. Um, Ulcers can cause black tarry stools, and if you don't treat an ulcer, that can be dangerous. So this person should have been referred to GI. Again, we don't know the full story, but they should have been referred to GI. The results of the CT scan and more blood work came back fine, but she says the IBS medication provided no relief. And again, kudos to this patient for continuing to advocate for yourself. If you're just joining now, I'm talking about how a wrong diagnosis masked a young woman's cancer. She was mistakenly diagnosed with irritable bowel syndrome, and she ended up having colon cancer. So she goes back again, saying this stuff isn't working. The medicine for IBS isn't working. She says, noting at this point she was having blood in her stools. Okay, this is where I try to give healthcare providers the benefit of the doubt, and hindsight is 2020, because we're reading this and we know she had cancer now. But please, again, especially if you're like an NP, please listen to your patients and please refer to GI. If all of this is going on and you feel like it's out of your scope of practice, refer to GI, please. Teague's 56-year-old mother was also a patient at the same medical practice where she was treated after being diagnosed with kidney cancer at 38, super young, and then breast cancer at 52. There is a genetic component to cancer. So if you this is why, again, get a family history on your patients. And if your patients tell you that there's a history of cancer, you need to, there's so many symptoms here. If you had just asked, right? Family history of cancer, black tarry stools, weight loss, that it doesn't matter what cancer you have, just general weight loss without changing your diet or exercising more is a very prominent symptom of cancer, and should be ringing alarm bells when it comes together with all these symptoms that she's having. So the 2-time cancer survivor underwent genetic testing and found she had Lynch syndrome. And Lynch syndrome, I forget, it's escaping me. After I got COVID for like the second time, my brain fog isn't like, I get brain fog. There's a very like huge doctor. He's so funny. He always calls himself a GI fellow, and his name is escaping me. He's so funny. I love his channel. And he's a GI doctor, and he was talking about Lynch syndrome in one of his like skits, because he does mostly like comedy sketches. I can't think of his name right now. He just had a baby. Anyways, so Lynch syndrome Lynch syndrome, often called hereditary non-polyposis colorectal cancer, is an inherited disorder that increases the risk of many types of cancer, particularly cancers of the colon, large intestine, and rectum, which are collectively referred to as colorectal cancer. So that should have been, again, alarm bells right then and there. Your mom, hello, Lynch syndrome. Like, I can't. Like, and if you don't know what Lynch syndrome is, look it up. Oh, my mom got diagnosed with Lynch syndrome. Oh, okay, let me look that up. Oh, that they're at increased risk for colon cancer. Oh, this girl has been having black tarry stools, weight loss, and doesn't feel right. And like, it's so obvious. Anyways, Lynch syndrome, which is a genetic disorder caused by a mutation in a gene, it increases the risk of various types of cancer. As you can tell, like, I'm just very passionate about these issues. Like, it boils my blood when patients don't get heard, and then they're like a prognosis or a diagnosis, not prognosis, a diagnosis is delayed. The gene typically is inherited and is passed from parents to children. If one, oh, thank you, Doc Schmidt. Is that his? It is him. I couldn't think of it. He's very funny. I love he's a great doctor. Anyways, thank you. So back to this. So if one parent has it, there's a 50% chance that their children will also have the gene. According to the CDC, people with Lynch syndrome are more likely to get colorectal cancer. Again, she literally told you her mother had it, which most people wouldn't even know because most people aren't undergoing genetic testing. So she had that on her side. You had that gem and you let it slip by. They're more likely to get colorectal, endometrial, stomach, liver, kidney, brain, and skin cancers, and they often develop these cancers at an early age before they turn 50, as evidenced by the mother being diagnosed with kidney cancer at 38. Colorectal and endometrial cancers are the most common cancers caused by Lynch. And again, this 28-year-old woman, had colon cancer. I'm curious. I wonder if I don't know, maybe Chadwick Boseman never went under, he died so young from colon cancer. I wonder if he had this gene. The likelihood of getting colon cancer, if you have the condition, can be as high as 80 to 85%. So again, if you are an NP, maybe asking, do you have a family history of cancer? Do you have a family history of Lynch syndrome? The syndrome is extremely underdiagnosed, again, because most people don't undergo genetic testing because of money. Genetic testing can be very expensive. Hopefully in the future, we can make genetic testing more affordable. That is the future, ladies and gentlemen, hopefully. So health experts, estimates that about 1 million people in the US have Lynch syndrome, but only 5% are currently diagnosed. Teague says she told her providers, this is where it makes me want to rip my hair out. She told her providers that her mother had Lynch syndrome, but they never suggested she be tested for the disorder. And honestly, at this point, who even cares if you're not testing her? Get this poor lady colonoscopy. She's symptomatic, right? Testing for Lynch should have been before she even had. It should have started with when she was just having the rumbly in her tummy, honestly. Well, actually, I should say the weight loss because that came first. But anyways, I'm telling them my mom had Lynch. I'm telling them that she had kidney and breast cancer. But when her father had cancerous polyps removed from his colon, all of a sudden, everybody's scrambling to get me a colonoscopy, she says. I just don't understand, how many signs did they need? I don't understand. Anyways, by now, 7 months have gone by. Teague's colonoscopy revealed a large mass that was the size of a baseball on her colon, and it was cancerous. My heart just sank. And here's the thing, when there's a delay in diagnosis, this is patients' lives, right? If you're a healthcare provider, that patient is just, to you, they may just be one out of many, but to them, that's their entire life. You're messing with their life. You're playing with their life. And the longer that she waits to get this diagnosis could mean more adverse outcomes, having to deal with more aggressive chemo, and just it's just so like it's just so much. Teague says that she got excellent care from her surgeon, but unfortunately, most of her colon had to be removed. She is fortunate, though, that she says they left me about 5 to 6 inches of colon. He was able to merge it with my small intestine so that I wouldn't have to have a colostomy bag and would still be able to use the restroom regularly, she says. So, again, if they had delayed this anymore, she could have ended up with a colostomy bag for the rest of her life because they didn't bother to listen to her. They didn't bother to order a colonoscopy. Teague says the surgeon who treated her was the first doctor to suggest she get tested for Lynch syndrome. Once she did, it was confirmed that she did have the condition. The American Cancer Society estimates there will be 106,180 new cases of colon cancer in the US this year. Approximately 4,200 colorectal cancers a year are caused by Lynch syndrome, according to the CDC. So this is what so moving forward, what can we learn from this? It may seem like what Teague experienced is extreme, but Otis Brawley, MD, professor of oncology and epidemiology at Johns Hopkins University, says most of what happened during her 7-month journey was not so out of the ordinary. And I agree. It can take many years for patients to be diagnosed with autoimmune conditions. It took my doctor, actually, he didn't even diagnose me. It was like the second ophthalmologist I ever saw, probably the fifth doctor I ever saw. So, if you have someone who is 28 years old who comes in, I've got weight loss, I've got nondescript symptoms, the doctor should, because so many people come in with that and it is absolutely nothing. The doctor should talk to them, the doctor should counsel them, and the doctor should not go directly to a colonoscopy even though the patient is asking for one. So this is what this doctor that is a professor at Johns Hopkins University is saying. Again, I understand his point of view. But when you have such an extensive family history, right? Of course, if someone says I've got weight loss, nondescript symptoms, but if, again, Lynch syndrome, blood in the stool, weight loss, that's not nondescript symptoms. That's screaming colon cancer. But if they have a prolonged period of having these problems, several months, well documented, where they come back to the doctor several times, then it might be appropriate to do some imaging to include colonoscopy, he says. Brawley also says that people with Lynch should undergo surveillance of their colon and several other organs like the uterus starting in their 20s. His advice to someone having a similar experience to Teague is to be persistent. I'm going to skip a few things here. He says it's very common for people to have very nondescript abdominal problems. Again, IBS, how does IBS present, right? IBS presents with extreme cramping, diarrhea, but there's no blood in the stool. There should not be mucus in the stool. If you're starting to get like blood or mucus, you want to get worked up and see, do you have Crohn's? Do you have ulcerative colitis, right? So these are some other potential diagnoses that need to be treated. And you can't just chalk it up to IBS always and hope that that's what it is. But Brawley concedes it's hard to second guess these things when you weren't in the room. That said, black tarry stools actually mean blood in the stools, he said. That would prompt that exactly. So again, MDs stick together as honestly, all healthcare professionals should stick together. I was watching Nurse Liz's video yesterday, and we were just talking about how as NPs we don't unite as much as like MDs do. Like MDs have each other's backs. But so he says all that basically like, well, it's reasonable that this was missed, but black tarry stools mean that there's blood in the stools. And again, that's not that IBS. There's no physical findings in IBS. Like everything looks fine. And IBS is very real. Okay. I'm not saying it's not real. It's not just in the head, right? IBS is very real, but there's no physical signs of like bleeding or weight loss, right? So The fact that there was blood in the stools should have prompted this person to do a colonoscopy, this healthcare provider to do a colonoscopy, and they should have got a good history and asked, do you have a history of cancer in your family? Still, it's not always cut and dry. So she was persistent. She made multiple trips to her doctor's office. She says sometimes she was in such pain, she made several visits to the emergency room, creating a paper trail. From the time she started going to the doctor with symptoms to the time the colonoscopy found the tumor was 7 months. By then, she had lost about 30 pounds. That's a lot of weight. A little bit outside of the length of time that it would be that I would consider to be normal, Brawley says, right? So she took longer to be diagnosed than average. I would say I would hope that these sort of things would be diagnosed within 3 or 4 months, but 7 months with folks having appointment issues, especially during COVID time, that's not that outrageous. It's on the edge of what I would call acceptable. Those are not my words, those are his words. But again, that he does have a point in regards to COVID. Like with COVID, during the COVID pandemic, there's just you couldn't get appointments. It was so far out. Um, so let's talk a little bit about colon cancer. For reasons that we don't fully understand, the rates of colon cancer are increasing in our younger patient population, and that's unusual. People born in 1990 are 2 times more likely to develop colon cancer and 4 times more likely to develop rectal cancer than people born in 1950. A significant portion of cancers that develop in young patients are the result of syndromes like Lynch syndrome. And because cancers overall are uncommon in young patients, it often takes much longer to get them diagnosed because doctors don't often think that a person in their 20s or 30s could have colon cancer. So again, if you're an NP watching this, we've been really, uh, one of the things we've really been talking to our primary care doctors about, especially with the understanding that there's a marked increase in young people getting colon cancer, is to keep that up and center when you see a patient who's complaining of bleeding from rectum, when you see a patient who's complaining of changes in bowel habits that you don't have a good explanation for. Don't ignore young patients with bleeding or these symptoms. Consider a full evaluation like you would with an older patient. Amen. Thank you so much for saying that. 2 years out from her surgery, she has not fully regained her appetite. She says her mental health has deteriorated. She has anxiety, is a bit more paranoid, and says she's becoming a hypochondriac. I don't blame her. For 7 months, nobody believed her. And then it turns out she did have cancer. Hopefully, she gets some therapy. But she believes she survived her ordeal for a reason. She's sharing her story in the hopes that it may help others, especially millennials. I do want our millennials to know, do not be discouraged. Keep going to the doctors, keep making appointments, keep going to the ER, create a paper trail. So once you get a doctor who's going to take you seriously, they can look back. She says, do not be discouraged by no insurance. Do not be discouraged by our age. Do not be discouraged by the circles that the medical professionals talk. Don't let anyone talk circles around you. Don't let anyone convince you that you're not feeling what you're feeling. If you know something's not right, if you feel something's not right, keep advocating for yourself. Teague says she will have her daughters ages 10 and 6 tested for Lynch when they turn 18. It says that a GoFundMe was created to help with her medical bills, but they didn't include a link. GoFundMe. So look up Teague's Strong Road to Testimony and see if you can find her if you want to donate to her. But this was no, let me see if I can zoom this in. So this is, why is colorectal cancer rising rapidly among young adults? And it was just a few reasons. So some groups have been hit by the rising trend more than others. For instance, although people of all races can develop colorectal cancer at a younger age, The spike has mostly been seen among Alaska Native American Indian and white people. However, Black people are still more likely to get colorectal cancer at a young age than white people, even though the gap is shrinking. Causes of colorectal cancer in young adults. So, experts don't know what's causing, but they do say that there's some risk factors, such as so the risk factors in older adults include obesity, physical inactivity, and smoking. So it's possible that some of the same factors are responsible for the rise of early onset disease, he noted. Get moving. Diet, gut bacteria, and inflammation. There's mounting evidence linking an unhealthy diet, in particular, one high in processed meat and fat and low in fruits and vegetables, to early onset colorectal cancer. Likewise, several studies have found that being overweight or obese may raise someone's chance of getting early onset colorectal cancer. Unhealthy diets have become more common in past decades. In addition, Americans are spending more time sitting and less time being active. Studies have found that more TV time is also linked to a higher risk of early onset colorectal cancer. But it's not clear if that's because being less active can lead to being overweight. Other scientists have turned their focus to bacteria that live in the gut, also called the gut microbiome, and certain types of bacteria have been pegged as accomplices in the growth and spread of colorectal cancer, and some may affect how well certain cancer treatments work. In lab studies, toxins from several types of bacteria that are normally found in the human gut caused cancer in the intestines of mice. Here's a nice little picture. Perhaps not surprisingly, gut bacteria is affected by the food and chemicals we eat, drink, and breathe. And I do think that our world is just becoming more and more polluted. And unfortunately, our food is more polluted. Our food is more processed. There's more chemicals in the environment, and even air pollution. Everything can contribute to altering our gut microbiome. Studies have shown that diet, obesity, exercise, and some drugs, such as antibiotics, can all change the number and types of bacteria in our guts. So, if you need antibiotics, take them. But one of my pet peeves as a healthcare provider, if your healthcare provider doesn't want to give you antibiotics, it's not because they're being a jerk. It's because they have good reason. Not only do we as healthcare providers have to be good stewards of antibiotic prescribing, because there's a tremendous amount of antibiotic resistance that is occurring, right? For example, most sinus infections, right? A lot of times people will come to the clinic and they say, I have a sinus infection. Really, what they have is like a head cold, right? Or an upper respiratory tract infection. Most of these are viral. And it's normal that you get congested when you get these. Give it some time. Give it at least 7 days. If it's been 7 days and you're still not feeling better and you're oozing just like green mucus, and green mucus isn't always going to be present with a true sinus infection, but if it's been that long, 7 days or more, 7 to 10 days, and you're still not better, okay, I can see you maybe needing an antibiotic. But don't come to us on day 2 and then get mad when we say this is probably viral, give us some time, you don't need an antibiotic, right? Taking antibiotics unnecessarily, it does affect, we have bacteria in our gut. An antibiotic kills all bacteria. It doesn't just kill that one bug that you thought needed to be killed. No, it's killing everything, right? It's kind of like chemo. It's just like boom. And I say everything, but it kills. There's gram-positive bacteria, there's gram-negative, there's anaerobic bacteria, but antibiotics wipe out a large number of bacteria in your gut. So you don't want to get antibiotic resistance, because let's say that you take a Z-Pack for every cough, sneeze, and whatever, and then you develop a resistance to Z-Pak. Then you take penicillin, you take a resistance to penicillin, and then you get really sick where you do need an antibiotic and nothing works for you, right? That's happening. There's super strains of gonorrhea that are not responding to treatment because people, exactly. And taking too many of antibiotics can also lead to C. diff, which is not fun. It's allows for this overgrowth of C. difficile in your colon, and then you just get basically just like diarrhea. And it's so hard to get rid of, and it takes very large, very harsh antibiotics. And if the antibiotics don't work, sometimes it requires a stool transplant from a family member, a healthy stool transplant in your colon. But anyways, let's move. Let me get back. Let me get off the derailed train. But I'm so like, people get so mad when you don't give them antibiotics. Like, can you, if you are in healthcare, can you drop a comment and like tell me if this has happened to you? I know that there's her channels from CNA to NP. She talks about this all the time, and I'm telling you, that's my biggest issue sometimes is like, you want to be a good provider, but it's so much easier to I've literally had providers tell me, "Oh, I just give people Z-Paks because I don't want to deal with it." So it's like you try to be a good provider and then you end up getting in like these power struggles with these people because they think like you don't want to give it. It's not that I don't want to give it to you, it's that you don't need it. Anyways, unhealthy diets and gut bacteria are connected in another way too. Both can lead to inflammation, the body's reaction to injury, disease, or irritation. In one study of mice, a high fat diet triggered gut inflammation and accelerated the growth of tumors in the intestines. As for gut bacteria, some bacterial toxins intensify inflammation. Studies have also shown that certain gut bacteria can recruit immune cells that help cancer grow, as well as block immune cells that fight cancer. Inflammation can also generate harmful chemicals that can mutate DNA and promote cancer. In addition, certain chronic diseases, including irritable bowel syndrome, Crohn's disease, and diabetes, can cause inflammation in the gut. Half of younger adults with colorectal cancer also have a chronic condition that can cause inflammation in the gut. I have widespread inflammation in my body because I have Sjogren's. So, who knows? Chemicals in the environment. If I'm very like pro environment and, I'm a tree hugger, right? I'm trying to reduce the amount of plastic that I use. If you would be interested in me doing a video on like more eco-friendly products that I use and eliminating plastic from your life, let me know. But we are literally polluting and killing ourselves. Oh, I shouldn't say that K word because then YouTube will block me and I can't monetize this video. Anyways, scientists are also examining factors in the environment as potential causes of early onset colorectal cancer. Such factors include things like air and water pollution, chemicals in soil and food, and pesticide use. Please, this is just a side note, like, please don't litter and please don't pour toxic chemicals down your drain or on the earth if you can. The National Toxicology Program has identified 18 chemicals that cause cancer in the intestines of mice or rats. Some of these chemicals might damage DNA, potentially leading to harmful mutations in cells of the colon and rectum. Okay, perfect. April said that she would love to see a video about eliminating plastic. I will have like all my favorite products because I've started to use drops, and I'm trying to not use, well, I mean, using plastic is inevitable. Like, I'm not that hardcore. My sister is almost like zero waste, but I'm not on her level. Other chemicals may have more indirect effects. For example, mixtures of certain environmental chemicals, sometimes called endocrine disruptors and obesogens, can disrupt the body's metabolism, leading to obesity, she said. And I have heard this. So there was a lady. It's our food in the United States is a lot more processed than elsewhere, right? Like, I go to Colombia and my cousins eat so much, but they are eating home cooked meals, right? They don't watch carbs. They're eating rice and beans, and a lot of their food is locally sourced. And I knew this lady, she was Venezuelan, and she was very thin in Venezuela. She said she would eat normally, she wouldn't be on a diet. And then she comes to the States and she says she blew up. She's like, Bridget, I'm barely eating and I've gained so much weight. And it's just because our food is so processed. Like, it's my grandparents on my mother's side. My dad doesn't have the best genetics, but my grandparents on my mother's side, like they were 100 plus when they died, and they lived their entire lives on a farm, basically growing and eating their own food. And they were centenarians, is what I believe they call them. Some environmental chemicals may have harmful effects on the complex assortment of bacteria in the gut. People are exposed to many chemicals at the same time, some of which may interact in different ways. Think of like, it's just like I don't know, like an X-Men movie, but our genes are being mutated, but not to give us superpowers. They're being mutated and they're giving us cancer. So it's important to consider all of an individual's environmental exposures over the course of their life, including exposures in the womb. How those chemicals interact with a person's genetic and epigenetic characteristics is also important. So some of us are more predisposed to developing autoimmune conditions. Some of us are more predisposed to developing cancer. And when that meets a certain environmental toxin in person A gets the cancer versus person B because person A had a predisposition. So, a few medical organizations have lowered the recommended age to start colorectal cancer screening from 50 to 45. And that's basically all I wanted to talk, except for like, I just wanted to go over some signs and symptoms of cancer. So like I said before, if you have any like you're having a lot of weight loss and you've been eating normally, you haven't changed anything in your diet, you're not exercising anymore and you're losing a lot of weight and that's not normal for you, that those are signs of cancer. This is directly from the American Cancer Society. And this is so nondescript symptoms can sometimes just be like fever, extreme tiredness, fatigue, or weight loss. But again, it's when you combine all these symptoms, right? Because people that are depressed can have fatigue, people that have autoimmune conditions can be fatigued. But when you combine maybe weight loss with extreme fatigue or tiredness, again, it's important to get checked out. So, fatigue or extreme tiredness that doesn't get better with rest, weight loss or gain of 10 pounds or more for no reason. Usually, with cancer, you're going to lose weight. But again, if you have like a massive tumor that's growing, it could actually be adding weight to you. Eating problems such as not feeling hungry, trouble swallowing, belly pain, or nausea and vomiting. Again, this one is just like nausea, vomiting is so common with so many conditions. So wouldn't necessarily read too much into that one. However, if you're having that with a bunch of other symptoms, yeah. Swelling or lumps anywhere in the body, make sure you get swelling or lumps checked out, especially if you feel like they're lymph nodes and they're large and they're growing. Anything that is out of the usual in your body that is changing, you didn't have before, get it checked out. Thickening or lump in the breast or other part of the body. I've had several of my friends get breast cancer very, very young. I have a friend right now fighting cancer, breast cancer. Pain, especially new or with no known reason that doesn't go away or gets worse. And it also depends on the area, right? Like I have plantar fasciitis for like 4 years and I've tried everything, but like I know I don't have cancer in my foot, right? So it's like, see me like, okay, I'm back. So, like like you don't get cancer on the bottom of your foot. So use a little bit of a common sense. Skin changes such as a lump that bleeds or turns scaly, a new mole or a change in a mole, a sore that does not heal, or a yellowish color to the skin or eyes. I actually had when I worked at an assisted living facility, there was a resident there, and she had like this a lesion, a scale, a plaque on the top of her scalp. And I believe he had diagnosed her. This was before I was a nurse practitioner. I was a nurse. I believe he had diagnosed her with seborrheic dermatitis. He would give her like some shampoo wash to use, and she would use it and she would use it, and it wasn't getting better. She had Down syndrome, right? So she can't advocate for herself. And normally, because I was the RN manager, like the what did we call them? The resident advisors would go with the patient, right? But I mean, this girl, like I would send her back to the doctor like every 3 weeks, basically. Like we would try what they would send, it wouldn't work. I'd send her back. Finally, I go to the appointment and I'm like, look, this is not healing. Can we do a biopsy? Did a biopsy, came back cancerous. So again, delay in diagnosis. So they ended up having to like take out a bunch of skin from the top of her um, scalp. It left a huge, like down the middle of her head, it left a huge bald spot. She had, again, like she she was just the cutest. Like she wasn't vain at all. So she didn't really mind, but her brother was very upset, rightly so, right? I mean, how long had this been going on and was not addressed? So if you see anything on your skin that is like bleeding, it crusts and it bleeds, it crusts and it bleeds, like please get that checked out. Cough or soreness that does not go away. I saw a TED talk about this really young, um, like Peloton cyclist. I think she was. She was some kind of like instructor, fitness instructor at the peak of her like fitness. And she had this dry hacking cough for years. And when she finally went to the doctor, they did an x-ray. She had lung cancer. Again, allergies can cause a cough. There's asthma can cause coughing, but get checked out, right? I don't want you to watch this and like be like, oh my gosh, I have cancer. Like that's not the purpose of this video, but it's important to educate. Unusual bleeding or bruising for no known reasons, change in bowel habits such as constipation or diarrhea that doesn't go away, or change in how your stools look, bladder changes such as pain when passing urine, blood in the urine or needing to pass urine more or less often, fever nights or sweats, headaches, that one's like, that's pretty vague. Vision or hearing problems, mouth changes such as sores, bleeding, pain, or numbness. So thank you so much for watching. If you made it this far and you're watching the playback, leave a little unicorn emoji in the comments below. I appreciate you all. Make sure that you hit that like button. Make sure you subscribe. Make sure you turn on that notification bell and drop a comment. Let me know what kind of videos you would like to see more of. All right. That is all for today. Until next time.